I just good. I just dry. It's dry.
All right. Good morning. This is Senate Health and Welfare. It is January 18th. And today we're looking at two bills, and we have two senators to introduce those bills. Unfortunately, we are without ledge counsel, so when we do our walkthrough, it'll be more of a cursory walkthrough. And we'll come back to these bills when we have our ledge counsel available. Okay, so first up is Senator Rebecca White. Thanks for being here. Why don't you introduce us to S-231, why you're introducing it, a little bit of background, and then we'll go through the bill.
Thank you, Chair Lyons. Yep, I'm Senator Rebecca White, and I serve the Windsor County District. And the bill before you today for consideration is S-231. It is titled An Act Relating to Establishing a Pilot for Community Nurse Program Serving Aging Vermonters. A little background on this bill. I wanted to start with a quote, which comes from the Community Nurse Program, a client from the Community Nurse Program in Heartland, Vermont, which is within our district. And the quote is from an anonymous client. I am here, I am alive and home. I would not be without their help. I would not be here without their help all through this difficult year. I just appreciate them so much. These are the most wonderful people I have ever known. And that's a client of one of the community nurses in my district. And I could read you testimonial after testimonial like that from individuals who have gotten the free services of a community nurse in our district. This conversation about community nurses came to me organically because we have numerous programs that are maintained by different municipalities in our district. And one of the concerns that they have had is the lack of funding and the lack of coordination. So we have lots of these programs popping up where there's a gap in services that people are experiencing that you, I'm sure, are very aware of in the healthcare field, where people don't quite get the needed attention to help them have good health outcomes. And the community nurse programs in our district have kind of risen to meet that challenge, but are facing a lot of difficulty because it's volunteer run, it's individually fundraised, and it's on such a small scale. So what does the bill actually do? It's one page. The first section is really the bulk of the bill. It asks to appropriate $450,000 to the Department of Disabilities, Aging, and Independent Living to establish a 2-year pilot to enhance the provisions of services by one or more existing community nurse programs to aging Vermonters in the program's region. So that's, I think, really what you need to know. The big point of the bill is to set up that 2-year pilot. And the vision behind doing a pilot was to help get a real sense of the value of these programs before we do major investment in them as a state, but to get a sense of how we can support them. There's an application process that's outlined. I'm not beholden to any of that angle of the bill, but I think the piece that you might be wanting to expand upon, if the pilot is not kind of the draw for you, if you want to do supporting community nurses in another way, the piece that on the back page of the bill that you might want to spend some time on is looking at how the program themselves function and what their value is. Because what I've discovered throughout learning about the community nurse programs has been that, again, tons of anecdotal, lots of support, but we don't necessarily have a handle on what the real data-driven value is to our healthcare system. And I would argue that in the absence of that data, I can say as much as I want about the cost savings. And I think we can all kind of think through the benefit of having a community nurse who works with someone to make sure that their prescriptions are being taken, that their home is safe for them, that they're being assessed for fall risks. We can all see the cost that's being reduced by those services, but I want to make sure that before we do any major investment in a program like this, that we can kind of wrap our hands around that and understand how it's filling a gap. So I have a couple things for you. The first is just a brochure from Aging in Heartland. This program in particular, if you wouldn't mind passing those around. This program in particular supports the older population of Vermonters, but we've got community nurse programs in Norwich, for example, in our district, and they serve a wide swath of people. It's not just dedicated to folks over a certain age. And I'm happy to answer questions, and I'll tell you, there's a lot of people watching on the live stream. So I just want to take a moment to thank any of the community nurses or advocates who are watching, because I have heard robustly that they are interested in this bill and would like to see a conversation happening at a state level for how we can support their programming, and ultimately the health of our communities.
Thank you. This is terrific. And as you're talking, a whole lot of questions just begin to pop up, as you can imagine. And so what we'll do is we'll ask you to help us with two things. One, with identifying folks who you think would be important to help us understand the program as it exists in Heartland. And then we'll be reaching out to others to think about how it links with any of the current state programs. And you have it here, you have the appropriation going to Dale.
Yep.
And we may want to be talking with others, and depending on what other programs are currently involved. So the funding, I noticed, is grants. I did read about this earlier, and there's our grants and donations.
Yeah.
And so I'm thinking that you're asking for a pilot to determine how to make this more sustainable. Our committee will have other, I'm going to let you know up front.
You give me the bad news early.
Obviously, no, well, there's always good news and bad news. It sounds like a super idea, and then we also know we have workforce issues, and this may be more competitive than places that are offering visiting nurse services. So that'll be some questions we'll have to ask. When we make our decisions on funding priorities in here, it may take a bit of time for this bill to make its way through because of that, but if and when the bill is passed out of this committee, it would go to appropriations. So we're going to have to ensure that we have all the data that we need to support it. So just some general comments there. And then a question that I have for you is, I'm looking at the services that are here. So how does this differ from our sort of Meals on Wheels program and our other programs that serve seniors or folks who have disabilities in our home?
Yeah, I would say that there's definitely a lot of overlap, as you know, just having someone that you can go to and talk to, like a consistent person like you might have with Meals on Wheels, just someone to communicate with. The main difference would be that this person can help you with medical related questions. The advanced directive support, for example, I think is unique to the community nurse program. If you've ever had to work with an older parent on an advanced directive, you know the benefit of having a impartial, friendly, well-versed person in the room versus you as an individual supporting someone or doing it on your own. So there's lots of those individual services that you might not necessarily have someone make space for with their doctor, or with like the more, I would say, there's a higher barrier for some of those services for certain individuals if they have to like go to the hospital or go to their doctor or travel to make those appointments. So what the community nurse does is they provide some consistent, I would say, lower barrier services. Like the fall risk stuff has been a big one I've heard from time and time again, is when you have someone go into your home, there is a different relationship that's built, because you can see, oh, well, obviously that's dangerous for you. And you can have a community nurse who might point out some high risks that when you're having a conversation in the doctor's office, your doctor, you might you're gonna try to give your doctor correct information, but you might not get the same level of insight just by having a conversation with a patient versus kind of seeing their space or understanding where they're positioned in their home.
So I'm looking at the bill and, we could all, we see the $450,000 and establishing a pilot program. You have a definition of the program. We can look at that later, but I'm looking at the number 1 on page 2, which is a successful application shall include. Then it talks about a community health worker position. How is that, or will there be definitions? We're gonna have to talk about that in here. Have you thought about the difference between a health worker position and a home visiting nurse?
Oh, that's a good question. I would, this is when I would go, hey, Katie.
No, exactly. So we need to take testimony, but obviously you've talked about some things that for which a nurse may not be appropriate, or could be appropriate, but overqualified.
Yeah.
So, yeah, if the step is too high,
I would say what I've seen with the community nurse programs in my district is they tend to be the kindest people who live in town, who are well-known, and who have a presence in addition to medical qualifications, and they are doing this part-time. So the main concern that I would have with any definition would be making sure we don't disqualify people who do this on a part-time basis, because it seems like the services that we're getting from the community nurse, while medical and health related, are also just having like a person that is a check and someone who can go in and have a real conversation face to face. So I don't want us to lose that in any definition.
Yeah, we'll have to sort of coordinate this with what happens with area agency on aging and some folks who may currently be able to play this role and how it fits.
Oh, sure, yeah.
But, yeah.
My question was similar to
ahead.
his, like, what is the minimum degree requirement or certification requirement for someone to do this?
That's a good question. The municipalities individually have been hiring these people. So they may actually have, and that's another thing. It doesn't seem like there's a consistent answer to some of the questions because it's so municipal. It's up to the individual towns. So I'm not sure what the requirements are for each of the individual towns, but I'm happy to, I'm sure as I'm saying this, there's someone in Norwich who's going, and will send me what they put when they put the job.
Well, if there are people like that, make sure they connect with our assistant and with make sure the committee gets that information.
Great, I will send that.
So Senator Hardy and then Senator Weeks.
Thank you. This sounds like a really great program, and I think there are programs like this in many of our communities. They're just called different things.
Yeah.
The visiting nurse program is one I know in Chittenden County, and in Addison County, it's Home Health and Hospice who does this work. So I'm wondering if it's just really a matter of getting this program folded into the existing structure, and whether or not how we would do that, like whether there are sort of standards or things that would have to change about on either side to get them included. Because if these are the agencies that are doing it in your district and there's not something else, then it would be important to make sure that they're included in the broader network. So
Exactly.
Yeah, I mean, I think
we have some testimony to take.
Yeah, exactly.
And you actually bring up a really good point, Senator Hardy, which is that one of the impetuses for even starting this conversation was that for a lot of the people I've spoken to who are a part of these programs, they feel disconnected and they don't feel like there's kind of a regional approach to this work.
Yeah.
And there is some benefit to having it be so localized, but there's also ways that they could be having far more efficient operating programs. So I think if there is a way that we can maintain the autonomy and some of the ability of these individual programs to operate while also taking from some kind of regional approach, if that's including them in another program that exists or giving them support. I think that would be exactly the direction they'd want to go.
So good, Bill. So I think that there's many of us in the room that have been down this road, unfortunately. So we understand the value, okay? But just a couple questions. I think to Senator Lyons' point that we have to understand the linkage with other programs.
Yeah.
We don't want to overlap. We have to understand what the gap is. And this is really a kind of a gap analysis, kind of a, you know, we're trying to fill an unfilled need. I don't read in here what the eligibility criteria would be. I think that's pretty important. And in that eligibility, I think that we have to understand that a state program or a community program is in competition with industry. And industry will have a perspective. So where that line is drawn and how that line is determined, I think it's very important to make this, to give this bill real legs so it stands on its own. That's just my thought. And then you guys were talking about qualifications of those. So you have eligibility, but then you have the qualifications of the health care providers.
Can we add outcome measures to that?
That's right.
Yeah.
That's exactly it. So I think all those are really important elements for this to really gain traction.
Thank you, Senator Weeks. And I would say that is the proof of concept idea is the main goal of this bill, is to, I think, again, we all anecdotally probably have experiences we can speak to about the benefit if you've had a community nurse come visit you or you've heard from a constituent, but it doesn't feel like we've truly had an opportunity to understand what the hard facts are about it. There is a report that Representative Holcomb had shared with me that Dartmouth had put together that I can send to the committee, because there is
Send it right to Kiki, we'll get it on our webpage.
nice.
Yeah.
And that does have some information, but it's so, I would say it's very region specific. So to Senator Hardy's point, my understanding is there's lots of these kind of individually run types of organizations. And the UVM research program actually picked this up as one of the bills that they're doing research on. So we might be able to kind of dovetail some private work that's being done, but I do want the state to actually investigate the benefit of this, because I know that we will, I mean, I think the risk.
So you're not passionate about it.
Not passionate at all.
Senator Williams and Senator Blewett.
Just a comment, thank you for the bill.
Oh,
I think, you know, I know we do this in my community as well, at what we call the Young at Heart Club. But what I'd like to see is I'd like to see Dale or even the Agency of Human Services come up with a plan, with a vision, because we got all these projects going on, and we're throwing $450,000 at the taxpayers' money. When I grew up, my town had two, what we called nursing homes. And they were private enterprises. And the local attorneys, you know, worked with the people for with their wills and to make sure that they didn't have Medicare and Medicaid at that point. But if it's predictable, it's preventable. We knew that the aging population problem was going to come 20 years ago. And because we didn't have a plan to deal with it, now we're dealing with it. So I'd like to see some kind of a plan at the highest level of government. If we're going to keep having government more and more involved with the funding of projects that used to be done at the community level, then I think that we need a plan so that we understand where this money is going to go. Because we do have a finite amount of that.
Thank you, Senator Williams, and I wholeheartedly agree. I think you have hit the nail on the head with we need a plan. And I hope that if you do hear testimony from the administration, I don't want to put words in their mouths, but they are a very stretched group of people, as you are well aware. My one point that I would make is that right now, because it's happening on such a local level with our municipalities funding it and relying on volunteers, I do think the risk of these programs continuing is actually a conversation we need to have. And the gap that would open up without us having a vision or having a plan, would lead to us losing, I think, some really valuable resources.
And I think it's, you know, they're all tax dollars. My municipality is using tax dollars to run the Young at Heart Club. But there's also federal and state funding out there to do the same thing.
Yeah.
So it's all our money. I'd like to see a plan for how we're gonna spend it.
So, yes, and so when we get folks in, we'll try to consider that. Now, I have Aging Well in my community. We have we have the Area Agency on Aging. Cove has now disassembled itself, so I don't know what more they're doing and what has happened to that organizational structure. So I know the Community of Vermont Elders, Cove acronym, but that's gone. And I'm gonna put my appropriations hat on for a minute, and then, because Senator Gulick has a question, I don't wanna monopolize, but one of the things that appropriations talks about, this is not me talking necessarily, but it is the Appropriations Committee concern, that when we see a number of wonderful volunteer or local efforts, 501c3s, then each one of those 501c3s comes to the state looking for dollars to continue and become sustainable. That is an issue. So our job in here is going to be to develop a policy that we believe should be supported by that appropriation. Just so you know, it's not a simple lift. Everything that you have said and that appears to be going on with the community nurse program. And I think there's an article in 7 days about it.
Bingo, yes.
So we'll have to bring that article in as well, because it is informative. We're going to have to sort out how it fits, and it is one piece regionally, so maybe this is the piece that we need to support. Would be great. Senator Brewer,
May I interrogate one of my colleagues in the committee?
you can ask a question. We're in a discussion mode now.
Right.
As long as it's Dave, you can.
Yeah, it is.
Of course it is.
And we're gonna move on to Senator Hartsville in just a minute.
Oh, yeah.
Go ahead.
Senator Weeks, could you elaborate on what you meant by industry? It would help me
The
understand the
commercial
question.
side, the commercial providers of the same
Private
service.
equity.
So, okay, so nonprofits, or are you talking about the hospitals? I was just wondering if you could be more specific.
Talking about businesses that.
Oh, both. Yeah, why not both? I mean, if you're talking about a gap, you've got to talk about all the
No,
stakeholders.
I understand that. I just wanted you to drill down a little bit on what exactly you meant by industry, because that's
Well,
a huge umbrella.
Okay, those that provide services identical or nearly identical to the services which are outlined in this.
Right.
With the paid
You're still not being specific.
Public, private?
All the above. I mean, whatever.
Yeah,
I don't know the answer because we
Okay.
just peeled
We gotta
open.
get-
they're all interspersed.
All right.
We
really.
gotta get to.
Just wanted to see if he had something specific he had in mind when he asked that question.
Well, okay, so I'll elaborate a little bit. So we're talking about public funds
Mm-hmm.
for this program. I
Yeah.
get that, okay? There are those that, you know, they're covered by insurance. And whether it's Medicare, Medicaid, this would be Medicare, I assume, for the most part. And then there's private insurance. And you know, to find the gap, to realize what the gap is, you know, I think we should listen to the voice of, again, I'll call it industry, but they have a voice, they have an opinion, and they have insights, they have years.
Okay, just to clarify, I wasn't saying we shouldn't hear from them. I just wanted you to define what you meant by industry, that's all. So that's
Yeah.
fine. Thank you.
All right, we're good. So, you've given us a lot of work.
Giving you some stuff to chew on.
Okay, this is great.
Thanks,
No,
Becca.
it's a bill I think that,
No.
that we will, follow up on, and we may be reaching out to you, as you're thinking, please provide Kiki with some names who you think would be helpful. we'll work through our agenda.
Thank you, and I really appreciate you taking time on this. Whatever happens with the bill, I just want you to know that the community nurses in our state are doing a lot of really good work, and if there's anything we can do to give them some support, especially post-COVID, that would be very well received, I think, throughout the state, so thank you.
Thank you.
It's a natural resource.
When we get posted.
Thank you, Senator Lyons, that's a very
Right,
good point.
true. We're still in the zone.
Okay,
Okay.
okay. Thank you. Senator Hardy, you wanna stay where you are and do your job?
Sure.
Whatever you'd like to do. So this is S-215, and why don't you introduce us to this
Yes.
proposal?
Thank you, Madam Chair. So S-215 is a bill about the Supplemental Nutrition Assistance Program, otherwise known as SNAP. It used to be called food stamps, that's the sort of old term for it, but it's SNAP. And I think a lot of the advocates are calling this bill the Give SNAP a Boost bill. So if you hear people referring to it, and I know they'll be in here, I think there's a like advocacy day coming up that
Yes.
they've told me
I
about,
don't
but
remember that.
yeah, I can't remember. Kiki might know, but in any case, the Supplemental Nutrition Assistance Program, as you all know, is a huge part of our safety net for families and individuals who are struggling with food security. And it has been for decades a really important program, and it was especially important during the pandemic. And we were able to expand it during the pandemic with the assistance of federal funds. And we've done a number of things in recent years about food security, including providing more funding to the food bank and also the universal school meals. But this bill is really targeting a population kind of similar to the population that the visiting nurse program that we just heard about, or the community nurse program, is older Vermonters who are often struggling with food insecurity and are isolated. So there are actually three things that Hunger Free Vermont is working with the agency on related to SNAP, or probably four things. One, unfortunately, is not going to happen apparently, is the summer meals program.
So we're gonna
Really
be taking
disappointed.
testimony
Thank
on
you.
that
I'm so
on
glad.
Tuesday, so let's,
Perfect. I won't
let's
talk
not
too much.
let's
about
not
it then.
conflate this with that.
Well, it's
Otherwise-
the same program,
I
so yeah.
understand, but just let's hold it.
I'm glad we're gonna take testimony on it. I just wanted to get that out there because I keep getting emails about it and it's really
Yeah, we're
disappointing
doing
and
that on
problematic.
Tuesday, just, you know.
Great. And then the second thing is about, community college students are allowed to, have SNAP if a state, participates, in the community college program with SNAP. And, Hunger Free Vermont is working with, the Agency of Human Services on making that happen. So that's not in the bill. It's not necessary at this point. But what is in the bill? The two other things are in the bill, and one is about the restaurant meals program. And this is a program that's part of SNAP nationally, and other states participate in this, and Vermont hasn't participated in it. But this would allow certain people who are eligible for SNAP and their spouses to use their SNAP EBT cards at a restaurant to get, at participating restaurants. It's not just any restaurants. It has to be a participating restaurant, and use them like, you know, a credit card and their SNAP EBT cards. And it's for people age 60 and over, or disabled people who qualify for it. So it's a really beneficial program for people who might not be able to, or have the time to, or the facilities to cook themselves a meal. They can go to a restaurant and use their EBT card. There are certain parameters around it. And one of them is they have to be participating restaurants. So the restaurants themselves have to get certified into the program through the federal government, which is a little bit of a challenge to some especially smaller restaurants. So this would provide some support at the Agency of Human Services in consultation with the Agency of Commerce and Community Development to help restaurants get certified for the program. And then people could go to those restaurants and use their EBT card for a meal. The states are allowed to add their own eligibility requirements for the restaurants. So the three that are currently in here are that the restaurants, locally produced foods are widely available to restaurant meal clients. So that it's really focusing on making sure our farmers also benefit by having local food producers at the restaurant foods, and restaurants serving foods that represent diverse cultural traditions participate in the restaurant meals program, so that we make sure that restaurants that might serve some immigrant populations or just having diverse cultural options. That's not all the same kind of food, so people have options. And that participating restaurants are located in geographically diverse regions of the state, so that it's not, sorry to pick on you, not all Chittenden County, so that there would be restaurants in every part of the state that people could go to and use their EBT cards. So that's the first part, and it would provide a position to AHS to help manage this program and help restaurants participate in it. The second is a transition plan for the calculation of minimum 3 squares Vermont, which is the other name for SNAP, to transition to what's called a minimum benefit calculation, or a moderate benefit calculation. And this would realign the benefits for especially older Vermonters, so that they get a little bit more each month to spend on food. As the cost of food has gone up, their benefits have not gone up, and they're falling way behind.
Can I ask, is this a one-time change to the moderate benefits, or is it an ongoing assessment over time?
It would be I think it would be a moving up the scale and then continuing along on that. But what this bill asks for is not to completely change it right now, but asks for a plan to change it, because it is, once I started looking into this and hearing from AHS, they were like, this is a lot of work. So the bill just asked them to come back with a plan for how they could do it by next year, come back to us by next year with a plan, and what the timeline could be, what technological changes would be necessary, the cost of implementing it, the types of staff positions, and any statutory or federal approvals necessary. So really the second part of the bill is just asking AHS to come back to us with a plan. I think it's really important that, and all of the things in this bill would benefit some of the older Vermonters who are really, really struggling to access food, and it would make it easier for them. And I also think that the restaurant meals program is an economic development program, because it would help our restaurants have clientele who could come and, every Thursday night, maybe they go and have a meal at their favorite local restaurant, and that would benefit the restaurants as well. So that's why ACCD is involved in the bill, is really an economic development piece.
So, yeah, and it will be interesting to see if, I know that some of the restaurants are now inviting people in for homeless, folks without homes, for meals. So this would maybe dovetail with the work that some restaurants are currently doing.
Yeah, and the restaurant program that we did during the pandemic, a lot of those restaurants I think would like to participate in this, and then it would benefit them, because I think it would be ongoing, and then they wouldn't feel the need to give away their food. It would be paid for, and it would be paid for by this program, which but I do think they need help getting involved in the program, getting the federal certification or whatever it is, because I think that a lot of states that do this, it ends up being like the chain restaurants that do it, because
Yes,
it's easy
the
for them to
McDonald's.
certify all of their chain restaurants. Here in Vermont, as we all know, we have a lot of local restaurants, like, I don't know, I'm picking Rosie's Diner in Middlebury,
Yeah,
you
that
know?
would be
and-
great.
And I know that there would be a lot of people who would love to be able to afford to go to Rosie's Diner and use their EBT. That's
So
just
that,
an
you
example.
actually, I'm gonna ask you a question, I know Senator Williams has a question. So, you get the position you have in here for helping the restaurants would be toward getting federally qualified through the EBT program.
Yeah,
Then there are also some help that would come from ACCD. So maybe there's some way to combine a position, or to use a position that's out there. I'm thinking, I put the appropriations concern in here simply because we have to set some priorities going forward.
absolutely.
But just think about it.
Yeah,
And
yeah.
We'll
And-
ask folks.
And
when
we
they
can
come in.
certainly ask both AHS and ACCD.
Yeah.
I mean, it was, I was the one who thought that involving ACCD would be helpful, and Katie and I
Great
went back
idea.
and forth about
Great idea.
where the position should be.
Yeah,
We ultimately put it in AHS because AHS runs this SNAP program. But wanted them to be, working with ACCD, but we can certainly talk to both agencies and see which makes more sense. Yeah.
okay.
Senator Williams?
So I know, a lot of the restaurants in my communities are struggling because they can't find help.
Yeah,
They're overwhelmed from the COVID,
yeah,
so I think we need to find a way to help them out, but, a lot of them are closed, it's hard to figure out when restaurants are open because they don't have the help so they have to close, but.
yeah,
The other thing is, just a comment, if we could, SNAP, 3 Squares Vermont is another word for SNAP.
yeah.
And then food stamps, we could just get the language to be consistent.
Snap,
It's
Okay.
hard,
That definitely would, but it's mentioned.
that's
in
a
the
snap,
bill.
I know, there might be a
SNAP and
reason.
3 Squares Vermont,
Yeah.
so I think 3 Squares Vermont, is the broader program, and
Yeah.
SNAP is, although we should ask them, but it's referred to both. Food stamps is really no longer a term that
Yeah, we
anybody
don't-
uses,
Oh, it was
but-
the old time.
That went
Yeah,
out
that's
in
why I
the
mentioned it.
Douglas administration, where I think it was Douglas, could have been Dean.
Yeah, so that's the bill.
Okay, more questions, comments?
I think I was.
You
next.
were next.
Thank you.
Absolutely.
Thank you. I'm a co-sponsor on the bill. I love it. I think it's fabulous. If anything came out of yesterday's joint hearing, it's the fact that there are a lot of folks struggling and a lot of folks, sorry to bring Chittenden County back into it, but 500% increase in homelessness in Chittenden County is, that to me, of the whole 3
Never
hours.
apologize, because we are a state together, and so
Right,
having
right,
consideration
Right.
geographically is important. I
Thank
wouldn't
you.
apologize.
But of the 3 hours, that number really has stuck with me, and probably kept me up a little bit last night. So, for lack of a comprehensive, robust plan, things like this are gonna have to plug the holes. And so I thank you for, elevating it, and I hope we can do something with this. Thank you.
Okay,
Yeah, and you already, I'm sure, know this, there's a companion House bill, so I don't know who's.
we're working on that. If we can do this here, that would be
Okay,
terrific.
great.
Honestly. And I would look to you for suggestions on testimony. I know obviously AHS, Economic Services Division, ACCD, who's over there, you think, and other folks who are supporting this, Hunger Free Vermont.
Yeah,
And we can get maybe we get some testimony and pro and con, but obviously the pro in here. I'm feeling that there's a groundswell of support in some way, so.
yeah, and just to note, in the restaurants, no restaurant would be required to do it. So if they don't want
Yeah.
to deal with it, they're not, if they have staffing issues and don't want the extra hassle,
Yeah.
they don't have to do it. It's really it's their choice.
Do we
And-
have restaurants that you know of who are sort of in the queue?
That's a great question. I'm gonna ask, so a couple of my restaurant friends to see if they
Yeah.
have, but I think there's a restaurant association, I think, that would probably,
And there are restaurants who are currently participating by helping people in need.
yes.
So we have some of those in downtown Burlington, for example.
Mhm.
So maybe we can identify a
And
couple.
the restaurants that were in the COVID era restaurant,
Yeah.
Everybody Eats, I think it was called.
Yeah, you're right.
I'm having those in, because I think they would probably be the restaurants that would step up first, because they've
So
already sort
let,
of
you know,
done.
get that to keep.
Okay, yeah, I will do that. Thank you.
Put that together and organize it. Be great.
Yep,
Yeah.
do. Did you have a question, Dave?
I did,
Oh, there you go.
if my colleagues are.
Martine gets her permission.
Martine gets
I didn't,
authorization.
your hand was so quiet.
So just, again, kind of curiosity
Yeah.
question. So what's the rationale for inhibiting restaurant participation in SNAP programs in the past? Like, what's the logic?
This is
Yeah.
two things, that the states have to say they're participating in this program, for the feds to okay it. And restaurants can't just do it without the state participating in the program. But I think that the state hasn't participated in the program because what I'm told, and we can hear more about this, that the federal requirement for restaurants to be certified, or whatever the correct term is a little onerous for small restaurants. So that's why
So let's go back in time. So back in time, it was about groceries.
right.
Yep. And then I think, not so long ago, it was about hot meals. You could buy a hot meal, like say you went to the grocery store, you could use the SNAP money for meals that are already prepared. Okay, now this is the next step, which is making use of restaurants and whatnot.
Right.
What is there like a cost logic that originally, like groceries, they're cheaper than prepared meals, they're cheaper than restaurants, and that's why?
They're accessible.
Oh, I see what your question is.
Yeah.
So I have a friend who's a food anthropologist who would be a great person to answer that question, a professor at UVM.
Put the professor.
I will see if she wants to come in and talk about it. But my speculation is that the way that Americans eat has changed over the decades. It used to be much more focused on this sort of like traditional, stereotypical mom at home making the meals. And it's evolved, in the 70s, 80s, it became a lot more about processed food and TV dinners and things that were easy to cook at home. And then over the last couple decades, we've seen this so much more during the 21st century. People are eating out more. People are getting takeout more. The sort of culture of cooking at home has declined in our society. So I think that this program came out of that sort of cultural change. And, what we can all have a conversation about whether that cultural change is a good thing or a bad thing. And I think it's probably a little of both. But I think that as our cultural norms have changed, the SNAP program has tried to keep up with those cultural norms.
But remember, your bill is 60 and over. So we're looking at the demographic changes and the needs of people who are sequestered or, have difficulty getting out into the cold.
Yeah.
That was,
Yeah.
my next question was, why 60 and over? Why not the whole group?
Yeah, I think
What's the logic?
for a couple of reasons. It may be that the program itself federally is just for seniors, and that's the only, seniors and people with disabilities, because those are people who may have the hardest time
Medicare
cooking for themselves. But also because I think there is a huge need in our aging state to make sure that our seniors are better fed. That is the demographic, and I think we can get some more statistics from the advocates in the agency, but that is that is a demographic that's experiencing extreme food insecurity. And I think, we've done a lot recently for families and young people. Last year, two of our biggest bills were about, universal school meals and childcare. And so I think that there's a real desire to focus on, okay, what can we do to help our seniors and our aging population? So I think that this was an attempt to really refocus and look at what are the needs of people who, in that demographic, in that age group.
And so the questions we're asking now really are questions that we can ask when the.
Yeah, I just.
Yeah.
Yeah, no,
just
this
to
is
kind
great.
of-
No, this is really good.
Good conversation.
Yeah.
And, go ahead.
Okay, so it's a federal program, but you're asking for a state level involvement. Is there a cost split between federal and state? And if so, is there any kind of round numbers on what this would cost?
Yeah, there is a cost split on SNAP, just like with Medicaid, just like with CCFAP, all those programs, many of them are federal state match. And so I'm not sure what the cost split is on the restaurant program and how it folds into. I'm not sure that it's an additional benefit. I think it's actually just an additional way you can use your existing
card
benefit.
differently.
So it's saying you're gonna get the same amount of money on your card. You can go to Hannaford and buy groceries, or you can go to Rosie's and have dinner. So I think that's how it works, but we can get that clarified. The second part of the bill that is about the report back, that would be, in that report would be how much money can we pull down from the feds? Because if we do change and go to a moderate needs budget, we would actually pull down more federal funding. We just don't know exactly how much that is. So that's one of the things we would learn from the report that we're asking for.
Then if I can, does the federal program also have the distinctions about ethnically diverse food and such? Or is that a Vermontism?
That would be, so each state can put in their own kind of requirements for the program. And the three that are in the bill were the three that I came up with that I thought were, good for Vermont, wanting to make sure we've done a lot. When I was on the ag committee previously, and we've done a lot with trying to infuse local foods into school lunches, into all the, any kind of food program, into our food banks, into our restaurants. And I wanted to make sure we did it in this as well, so that our farmers can benefit as well, and our food producers, so that if we're gonna spend public money on food at restaurants, let's also have that sort of downstream effect.
Yeah, I get it, and I agree with the concept.
Mhm.
What was it? Local farmers, ethnically diverse, geographically distributed. Okay,
Yeah.
I get that,
Yeah.
but I wouldn't let that interfere with the program rolling out.
No.
Oh, I don't think it would
No,
actually.
I'm gonna bring us to some closure,
Yeah.
because we wanna move on.
Yeah, sure.
Everything that you're asking, right now, we're getting into discussion about markup on the bill. So I'm gonna suggest we have some testimony, and then we get right back to this, because this is a great discussion going forward and making some decisions. Yeah.
Getting shut down from both sides.
I'll keep talking. You want to talk at home?
Well, I think it's a good
Okay.
discussion. I'm not shutting down the discussion.
No, we gotta
It's
move
not
on.
the
Joking.
time for that.
Joking.
Okay, I know, but I'll be criticized later. Okay, so what I'm going to do is suggest that, we stop with this one. It's another bill that sounds great, and it fits in with the previous bill. We're talking about our aging folks. And so before we look at the bill, we might want to look at the plan the aging plan that we have put in place in the state, and we've worked on the past couple of years. We're going to take a break. I thank you all for coming in to testify on 109, but we're going to take a break right now for 7 minutes.
Oh, wow, that's great.
Thank you.
Thank you.
Yeah,
I'm just joking with you.
No, I know, I
Hopefully you
understand
can
that.
tell when I'm serious.
But there are some people on Zoom right there that are going to say that I was critical of